Some of you may remember the ruckus that was caused by William Proxmire in 1975 when he began to offer his Golden Fleece Award. Any of you remember that? These are for wasteful government expenditures. I think he fit in well today with the tone of our times. But he began the award in 75, and it went till 1988. And some of the awards I think were justly deserved, but one of them in particular really riled me. It was given to someone who was doing research on love. How people fall in love, why people fall in love. Now this was a time when we were emerging from the Vietnam War, a time when we were dealing with race-related violence, a time when we were seeing the beginnings of drug-related violence, and a time when the family was beginning to break apart with rising rates of divorce. And here Proxmire was criticizing the serious study of love as soft and unscientific. Well, Jeff Levin has made a career delving into what some would say is soft and unscientific. You can't get much softer than Jeff's topics of interest. Divine love, faith, mystical experience, prayer, being part of a religious community. But what Jeff has done is remarkable. He's demonstrated, in a pioneering way, important links between these soft signs, what we might think of, what I think of, and I know he does. These soft signs are actually signs of the deepest dimensions of human experience, the things that make us most uniquely human. He's identified links between, scientifically, links between these soft signs and hard signs. Hard outcomes. We're talking about hypertension, colitis, cancer, morbidity, and mortality. This is truly pioneering work, and it has led to many other scientists taking note and picking up his passionate and articulate call for what he's sometimes called not a psychosomatic, but a theosomatic approach to medicine, integrating body, mind, and soul or spirit. Much of this growing body of work is now summarized in his friend, my friend, Harold Koenig's second edition of his book, Handbook of Religion and Health. I mention that because, fittingly enough, Jeff wrote the preface to this really important authoritative volume. Jeff's work has been consistently marked by intellectual courage, deep seriousness, scholarship, rigor, and always vision. He saw where this field could go, might go, long before others did. He also has a deep sense of appreciation for history, where we come from. There are forebearers, and always honors those people. Let me now just note some of his remarkable credentials here as well. Jeff is an epidemiologist and religious scholar. He holds a distinguished chair at Baylor University, where he's University Professor of Epidemiology and Population Health and Director of the Program of Religion and Population Health at the Institute for Studies of Religion. He also serves as Adjunct Professor of Psychiatry and Behavioral Sciences at Duke University Medical Center and has been Scientific Chair of the Kalsman Roundtable on Judaism and Health Research, located at Hebrew Union College, Jewish Institute of Religion. Jeff was the first scientist to systematically review the empirical literature on religion and health, and the first scientist funded by the NIH to conduct research on the topic. He received his PhD from the Graduate School of Biomedical Sciences at UTMB and is a fellow of the Gerontological Society of America. He's authored or edited over 160 publications, including 8 books. The most recent are the forthcoming Judaism and Health, to be published by Jewish Lights, and Healing to All Their Flesh, Jewish and Christian Perspectives on Spirituality, Theology, and Health, to be published by Templeton Press. Jeff lives in Woodway, Texas, with his wife, Lee Steele, who I had the great pleasure to meet this morning at breakfast, who is herself a PhD graduate of the UT School of Public Health. I'm really looking forward to Jeff's talk today. I'll just mention very quickly that the talk itself illustrates how Jeff, again, is at the cutting edge of the field. It's very interesting that Jews as a group are overrepresented among scientists and medical professionals. But Jews have very rarely focused on the implications of Judaism for health and healing. Many Jews in our field, but rarely focus on Judaism and its implications for health and healing. Well, Jeff, again, is an exception to the rule. He's a leader in this area through his work with the Kalsman Institute. And we're just very fortunate to have him with us today. His lecture is entitled Judaism, Medicine, and Health, an Emerging Scholarly Field Comes of Age. Please welcome Levin.
Just a lovely introduction. I just want to say, I don't have a clicker, so if you see me go like this, I am pointing to my beloved wife and partner, Dr. Steele, and then we're going to advance the slides. This is really, really a true honor. I mean that very sincerely. I have known about and been a fan of the Institute for almost 30 years, since when I first came to UTMB as a graduate student, as a very young fellow, and came to the Texas Medical Center for the first time. I remember the old building. I've been in it. I actually, incidentally, even got to know Dr. Fellers by telephone, spoke with him several years ago. We actually had a wonderful conversation about the Institute and its future and where it was going, and I was just incredibly honored to have the opportunity to give some of my reflections on where the field was going. And so now to give this lecture is just tremendous. I want to say to be introduced by Ken is also a great honor. I've known Ken for probably going on 25 years. And I also have to say, some of you know this, but the speaker last year, Rabbi Sam Karf, I can honestly say I've known for 50 years. Sam was my childhood rabbi in Chicago, Illinois, who I first met when I was 2 years old. So this is just a real treat. What I'd like to do here, rather than, this is not going to be the type of lecture where I present findings from my latest study and show you slides with statistics and numbers, and really think of this more as kind of a review. Think of it more as a travelogue. And what I want to do is provide some background on this emerging field. You can call it a field qua field of Judaism and health. It's kind of the intersection of Judaism and the Jewish religion and the Jewish people with health and healing and medicine and healthcare and bioethics and all of that, and kind of lead you on kind of a journey of how this has evolved and been cobbled together and coalesced into a scholarly and professional field. So I'll give you kind of some of the historical background on how this has emerged. Then I would like to talk some about the Kalsman Institute on Judaism and Health, which is actually a department of Hebrew Union College Jewish Institute of Religion, which you've heard mentioned already, which is the rabbinical school and graduate school of the Reformed Jewish movement. We don't use the word denomination in Judaism, we use movement, but it's the HUC is the seminary and graduate school for Reformed Jewish rabbis, and Kalsman is simply a department or an institute within there. And then if there's time, I have some slides on what I think are some of the most interesting new directions in scholarship and in research in this field. So hopefully we'll have time for that. Well, my travelogue starts at what for at least the Reformed Jewish world is the center of the universe, Cincinnati, which is the location of HUC-JIR, as some people call it HUC. So I might say HUC, I might say HUC, and this is the Cincinnati. There's actually 4 campuses. There's the main campus in Cincinnati, and there's a campus in Los Angeles, and a campus in New York, and a campus in Jerusalem. And the main campus has now been recently rebranded as HU-Cincy. So this is HU-Cincy. And my story begins in 1977. We were living in Kansas, and I was speaking at the annual meeting of the Gerontological Society of America, which is one of the professional societies, and I was a discussant. And anyway, the meeting was in Cincinnati. And I thought, Cincinnati, that's where HUC is. I've never been to the campus, and I'm a member of a Reformed congregation. Maybe it would be neat to visit, almost like, if I mean this respectfully, like a Hajj. You know, for a Reformed Jew, for a liberal Jew, to go to the campus, to look at the library, to see the art museum and the whole thing. So I wasn't doing anything one of the afternoons. I'm at downtown at the annual meeting at the library. I checked the bus schedule, and I took a bus. And I got off there, and I was on the campus, and I was just thrilled, you know. And up on the wall in one of the hallways, just like at any university like Texas Medical Center, there was a flyer for a noon seminar, and I wish I remember the exact title of the talk, but it was something like Reformed Jewish Congregations as Holistic Healing Centers, or something like that. And I thought, oh my God, this sounded like, this is the craziest thing I'd ever heard in my life. And I got there, the talk had just ended 5 minutes earlier, so I missed it. I spent the rest of the afternoon there, and eventually I came home. But it intrigued me. Holistic healing, medicine, Reformed Judaism. When I would think of like the interface of spirituality, religion, and healing. Christian Scientists think of maybe Roman Catholics think of Wednesday night services in a Pentecostal church, but was there a tradition of medicine and healing and healthcare and Judaism? Well, I began to do some digging, and of course, there's a tremendous tradition of rabbinic writing and scholarship dating back well over 1,000 years. This is a quote from Rabbi Emanuel Yakubovitz, the former chief rabbi of the United Kingdom, the predecessor to Rabbi Jonathan Sacks, and also a founder of the field of bioethics. And Rabbi Yakubovitz said, religion and medicine have been in alliance all over the world among everybody through the course of human history, including in our tradition as well. And so what I'd like to do with some of the next few slides is just kind of step through some of these points of convergence. And there certainly are within the Jewish canon, within our scriptural sources, within the Bible, and the writings of the Chazal we're big on acronyms. It stands for, got all these rabbis here. Chochmenu Zichrono Livracha, our great sages of blessed memory. These are the great rabbinic sages of the first millennium who wrote or redacted the Mishnah and the Talmud and the early Midrashim. And within the Bible and within the rabbinic literature, there's all kinds of references to health and disease and healing and medical decisions. And then within the later rabbinic commentators and medieval commentators, people like Maimonides, there's a lot of writing as well. He was a physician and he was a philosophical theologian, and he wrote on both topics. And then finally, more contemporarily, there are all these intersections of Judaism and medicine, broadly defined. There's a field of Jewish bioethics, people efforting to apply halachic reasoning to Jewish law to medical decision-making. There have been health policy statements. There's a field of Jewish chaplaincy and pastoral care, Jewish psychology, congregational resources. And there's even weirdos like Ken Parkman and I that are doing empirical research on Judaism and physical and mental health. Well, so first, when I got back from Cincinnati, this is 15 years ago, one of the things I started to do, as part of my Jewish learning and practice, I study the Parsha every week. The Parsha is the weekly portion of the Torah, the 5 books of Moses. And as Jews, we track through this every week. And so wherever you are in the world, if you're a Jew, you're reading the same little piece of the Torah. And it starts basically after the Jewish New Year and runs all around the year. And there's 54, there's just basically weekly portions. At any rate, each year I read a different commentary or a different translation of the Bible. And I got a bunch of Post-it notes at Office Depot, and I began taking notes on Post-it notes every time I would come across a scripture or something from the Talmud or something in the Midrash or whatever that had something to do with healing or medicine or healthcare. I just kind of copied it down. And this went on for about 10 or 11 years. And finally it got all done. I thought, maybe I should write a paper, for a medical journal or something like that. So I summed all of this up and published a paper in one of the leading CAM journals, one of the alternative medicine journals. And this is the article. You can find it in PubMed, where I kind of summarized a lot of what the Jewish canon, if you will, had to say about longevity and disease risk and so on. And usually I'm not attesting to the medical truth of all of these things, but it just made the point there's a lot of information out there that the Jewish canon has had a lot to say. Publishes. In case you think I'm the first person that ever did this, has anybody seen or heard of this book? I'm just curious. That's very interesting. This is a book, Dr. Preuss was a physician. This book first came out, I think, in the 1920s. And Fred Rosner is a preeminent Orthodox figure. He's an Orthodox rabbi and a physician. I think he is or was chief of staff at Mount Sinai, and he's at Albert Einstein. and one of the leading Orthodox figures in translating the works of Maimonides and in writing on bioethics. This book is essentially for the doctors in the room. Think Cecil's or Harrison's, textbook of medicine. It's hundreds and hundreds of pages, divided into chapters on anatomy and pathophysiology and treatment and ophthalmology and gastroenteritis, every disease entity, every aspect of healing. And it's fleshed out with literally thousands of references to Torah, to Talmud, to Midrash, to Mishnah, to Sefta, in which some aspect of Jewish canon or rabbinic writing referenced any of these topics. It's almost like it's like a textbook of medicine. And as an aside, I had remarked to a friend of mine, a Jewish doctor in New York a number of years ago, I said it's almost like this shows that there's almost a Jewish folk medicine. Just like Ayurvedic medicine emerged from the Sankhya philosophy in Hinduism, or Unani emerged from the Islamic reading of Greek humoral medicine, or traditional Chinese medicine emerged out of Taoism and Confucianism. And he said, well, no, there really isn't a Jewish folk medicine. He said, well, actually, modern Western biomedicine and psychiatry is Jewish folk medicine. I said, okay, well, I know about that. But it's an incredible book, and it's a paperback, and I'd recommend it anyway. It's not like bedside reading, but it's essentially a textbook of everything and anything about medicine and public health, citing Jewish scriptures. In addition, there were medieval commentators. Ramban, also known as Rabbi Moses ben Maimon, Maimonides, was a physician, was a philosopher and theologian, wrote medical textbooks, wrote a compendium distilling the Talmud, the Mishnah Torah. Ramban, also known as Nachmanides, also was a physician, wrote about the human body, wrote about the Kabbalah and mysticism, wrote a Torah commentary. Seforno, also Rabbi Obadiah Seforno, also was a physician, was a rabbi, wrote a Torah commentary. So historically, there's this tradition of people who were rabbis and doctors. And I have amongst my relatives, I have rabbis and I have doctors. But in our case, in our tradition, there were people who were both. So there were essentially John Grains. In our tradition, there were both clergy and were both physicians, and wrote on both topics and wrote on the intersection of topics. They date back, 1,000 years. Well, more contemporarily, there have been efforts to apply teachings about Jewish law to aspects of health and healing and medicine as a contemporary field of study. Jewish bioethics, I think probably people would say, date to this work in 1959, the year I was born, by Rabbi Jacobovitz, called Jewish Medical Ethics. There's now actually a Society of Jewish Ethics that has a Jewish bioethics group. It used to be its own society, and they have an annual meeting, they read papers, and it's like any other field. And the sorts of issues that are discussed throughout the academic literature on Jewish bioethics are pretty much the same kinds of issues that animate bioethical writing in general. These kinds of clinical decision-making regarding different types of medical treatments and interventions, euthanasia, stem cell research, and so on. But there's also, this is a quote from my friend Rabbi Elliot Dorff, who is, I would say, maybe the leading posek in the conservative. Posek is a rabbinic decisor who issues responsa, who, when there are new questions, for example, regarding bioethical decisions that need to be made, refer to a committee in the Reform movement. There are people who do this in the Orthodox movement, conservative movement. And Rabbi Dorff, who's in Los Angeles, is, if not the leading, one of the 2 or 3 leading conservative rabbis that in this tradition. And in his wonderful work, I have a slide of this book a little later. This is a quote from him. We have a universal duty to heal others because we're all under the divine imperative to help God preserve and protect what's God's. So I think this suggests that there's also a societal dimension, societal obligations regarding ethics and medical ethics. And accordingly, over the past 2 decades, there have been health policy-related statements regarding healthcare reform and environment and global health issues. And Jews, in fact, were at the forefront of the debate, the discussion regarding healthcare reform. There were major, quote-unquote, denominational statements from the different Jewish movements. So I don't have a pointer left to right. There were major reports and statements from the Reform movement and Reconstructionists and the conservatives and the Orthodox and then the far right of Orthodoxy. And you can find these reports and things all over the internet. A variety of Jewish organizations and institutions also issued white papers and reports and position statements and had lobbyists in Washington and were very involved. There were also rabbinic statements by the leading poskim, plural of posek, from the different movements. A lot of these are very general works of responsa or rabbinic decisions or on ethics in general, but included kind of communal health policy responsibility types of issues. The first three are from the Orthodox rabbis, and over on the right, the Rabbi Dorff and Rabbi Galinkin's works. So Reconstructionist work, and the rest are from the leading writers of Shuvot, as we say in Hebrew, responsa and reform movement, culminating at the far right, a series of reports put out by my friend Rabbi Richie Address, who was at the Union for Reform Judaism for years and now has a pulpit in New Jersey. It's a series of between 15 and 20 little, pamphlets. They have all sorts of information on a variety of bioethical issues, from abortion to euthanasia, to transplantation, to healthcare reform, and so on. And they're wonderful little packets of guidelines. So this kind of covers the spectrum. And then also there are great academic works by Jewish bioethicists, again, across the denominational spectrum of the Jewish movements. Some of these folks are rabbis, a lot of them are Orthodox rabbis. Bring your attention to this work here by Lori Zoloff. Lori is not a rabbi, but an academic bioethicist at Northwestern. It's a wonderful book, probably, I would say, the best contemporary work on a kind of societal perspective on applying Jewish morality and bioethics to the larger issues of healthcare reform. Very nice book. And there's also a field of pastoral care and chaplaincy. There's a National Association of Jewish Chaplains. The healthcare chaplaincy, a lot of us familiar with, have a Jewish department in the Reform movement. In JTS, that's the Conservative Rabbinic Seminary. There are CPE programs, training programs, and so forth. Been a couple of books. Brand new book, Professional Spiritual and Pastoral Care by, Rabbi Stephen Roberts. The book just came out. I haven't read it yet. For many years, the first and last word on this topic was a work by a very dear friend, and a lot of us know and love, Rabbi Dale Friedman, Jewish Pastoral Care. It's in its second edition. A wonderful work on the topic. This whole Kabbalah and spirituality and mysticism and meditation and healing topic that has a lot of currency in the present day, that I've found through my research and writing within the kind of the secular world and the Christian world, has a lot of resonance with folks with New Age interests and holistic health interests, and among more liberal mainline Christians. Interestingly, within the Jewish world, there's a lot of resonance, specifically more Orthodox and traditional Jews. Certainly interest in liberal Jews, as well as my experience in Cincinnati showed, a lecture on holistic healing centers. But I think, unlike in the Christian world, there's a tremendous amount of interest in transcendence and self-actualization with very traditionally religious, quote-unquote, right-wing areas. For example, at the top, probably the three most notable works ever written on Jewish meditation were written by the late Rabbi Aryeh Kaplan, as we say, of blessed memory, who was an Orthodox rabbi and a physicist, passed away about 30 years ago, and wrote these incredibly detailed works on meditation. That to this day, I've been in Reform temples and conservative synagogues that have used that book as a text on monthly little Jewish meditation classes. This work by a very traditional Jewish rabbi, Orthodox rabbi, and physicist. So, and a lot of these other works are works by Hasidic Jews and Orthodox Jews. And it's just fascinating to me. Another kind of point of convergence is something that for the last 20 years or so has been known as the Jewish healing movement. And this has been a movement of Jewish communal organizations and congregations to come together to, I'll just read it, a network of local national groups to provide communal and congregational resources for healing and aging and wellness and illness and promoting personal growth and spirituality. There's various Jewish federations have programs. There's programs within congregations. There have been liturgical innovations. The National Center for Jewish Healing has kind of been the leader in this movement. The rabbinic director is another friend, a dear soul, Rabbi Simcha Weintraub, a conservative rabbi and a social worker, and he's been instrumental on the right of some of the logos of some of the organizations throughout the United States and Canada that have done this work. And then finally, the last point of convergence is research. There actually are those of us who are academic scientists, ecologists, like epidemiologists, sociologists, doctors who are doing, collecting data and doing research either on the health of Jews or on the relationship of the religiousness of Jews to health or well-being, the same way that there has been research on health and spirituality in the larger world. And that's what Ken Bergman alluded to earlier. So many people in medical science and in science are Jews, and there's whatever we're up to, 3,000 or 4,000 studies now in spirituality and health, yet so little of this work is focused on Judaism and health. And in the last few years, there's been social and behavioral research. There's been actually health services research on Jewish utilization of mental health services and things like this, dating back to the old Midtown Manhattan study 50 years ago in New York. There have been program evaluations of congregational-based programs. And then finally, strange people like me actually doing analyses of population research on indicators of religiousness correlated with measures of morbidity and mortality and health and illness and here in Israel. And can't really see this. My current project I've been working on since I've been at Baylor the last couple of years is to identify all of the various population data sets in Israel and the United States that for whatever reason that have some health measures and also have some religion measures, and just kind of go in and makes it sound kind of scaffold, knock a paper out of each one of these data sets. Obviously, there has not been a major global survey of spirituality and health in Jews, but there have been wonderful surveys of health that have included a few religion questions among the hundreds of questions, and there have been studies of Jewish religion, like the National Jewish Population Survey, that for whatever serendipitous reason have thrown in one or two questions about health. And so I've published a paper using the National Jewish Population Survey. I published a paper using the Israeli sample of the World Values Survey. I've got a paper just published in the Israeli journal Psychiatry from the Israel sample of the Gallup World Poll. I've got two more papers under review here in Israel on a well-known study of aging and retirement in Europe that also had an Israeli sample. The day I came down here, I got beeped on my iPhone that I applied for access. There was an Israel social survey that they do every year that has a few questions on health, and in 2009, for some serendipitous reason, they included 60 questions on Jewish religion and spirituality. So I'm not an Israeli citizen. I applied, and I got an email back saying we sent them $100. We'll get the data set. So that's on its way. So hopefully I'll knock one out of that data set. And then there was an Israel National Health Survey that, again, serendipitously had a few religion questions. I don't know how I'm going to get access to that, but I'm working on it. But long story short, by the time this is all done, I hope to have knocked out 6, 7, 8, God willing, papers on Judaism and health and mental health here in Israel and in the Jewish diaspora. And so kind of provide a baseline to what can come next. Well, I wanted to briefly talk about the Kalsman Institute. This, as I said, is a department within the Reformed Jewish Seminary at their Los Angeles campus. Kalsman was formed about a dozen years ago, and the story I was told, somebody had a wonderful pastoral experience with one of the rabbinic interns, and that family, a friend of the family, had ended up giving a few $1 million, and the Kalsman Institute was formed. And the original director was my friend Rabbi Bill Cutter, retired, and was succeeded by a very dear friend, Michelle Prince, who's a graduate at HUC in Jewish communal studies and is also a social worker. And the content areas you see are pretty much the sorts of things I've been talking about in my talk, the different areas in which Judaism and medicine have intersected. And what Kalsman is about, they hold conferences, they hold symposias, they do CPE, continuing pastoral education, they publish reports, they kind of interface with they're trans-denominational, they interface with the various seminaries and denominations across the Jewish spectrum. They have events. Just in the last few years, there have been some books that have come out of Kalsman. At the top, the blue book and the red book are edited by Rabbi Bill Cutter, wonderful volumes. There have been special issues of journals. Shema is a Jewish journal, had a special healing issue. Journal of Religion and Health, the very last issue, it just came out. I edited a special issue. Actually, I had Shayan Sessions as well as had a wonderful, beautiful book review by Sam Karf about Bill Cutter's latest book. And then one of my papers appeared in there, and then 7 or 8 other really excellent empirical studies that had been done. A forthcoming issue of the CCAR Journal, which is the journal, the peer-reviewed academic journal of the Central Conference of American Rabbis. There's going to be a special issue on health and healing that my friend Michelle Prince is one of the co-editors of. A journal, incidentally, that I believe Sam edited almost 30 years ago, I think. So a rabbinic journal now is going to do a special issue on this topic. A pastoral care journal, a medical journal has already done a special issue, and then a Jewish journal has. So I mean, these are just little touchstones of how things are evolving. One of the projects, Michelle and I kind of became a tag team several years ago, and we decided that one of the things that needed to happen was to use Kalsman as a locus to ramp up, kind of take all these little pieces that I've talked about, and the word we've used is kind of cobble them together into a field, into a scholarly field qua field of Judaism and health. And to that end, we applied for and we got some funding, a little under $100,000 from the Templeton Foundation, to form a roundtable, a working group. And we identified a number of people. Ken Parkman was a member of our advisory team. And we've had some events over the last 2 or 3 years. We issued reports, a variety of things have gone on. And the goal is field building. Just all the sorts of things that build a field. Sponsor literature reviews, reports. We created a website. And we had a wonderful retreat in Los Angeles with Jewish leaders across the spectrum of denomination. We had Reform Jews, Conservative, Reconstructionist, Orthodox. We even had a Haredi Jew, an ultra-Orthodox Jew. We had leaders, deans of the various seminaries, all together in one room talking about how we could further this work. And just skip this one. Well, just because we're in time, the last thing that I want to touch on this doesn't exhaust all the things that are going on in the field, but what to me I would say are some of the most interesting kind of frontiers for this area. And one I want to talk about that I think Jen will be familiar with, this is www.jpsych.com. I would encourage everyone in here with an interest in spirituality and mental health to look at this website. This is David Roseman, who was a doctoral student who trained under Ken at Bowling Green, and he's now, I think he's at Harvard. I put that he's at Harvard. And he's a young psychologist, and he's basically created a website and lab and research program. He's kind of I was going to say he's a one-man, I guess he's a two-man. Zvi Karatinsky, is that his partner? So there's 2 of them, and David has, just in the last, I'm going to say 2-3 years, published almost 20 papers, many of them with Ken, a bunch of presentations, they validated scales and indices, and he's just cranked out all these clinical studies and online studies of all kinds, some of them are intervention studies, all kinds of aspects of the relationship between Judaism, Jewish spirituality, and mental health and psychological outcomes, but with a very strong emphasis on Orthodox Jews and on the more traditionally Torah observant community. So Orthodox and Haredi Jews. And I think the world of his work. He's just taken a field that didn't exist and almost created it out of whole cloth. And again, in a short amount of time, he's published tons of papers. And I just think he's just doing, he was well trained. He's done fabulous work. One of the things, and also as a member of our Kalsman Roundtable group, another thing that we have done, that Michelle Prince and I at HUC have done, we've developed the website. This is very much a work in progress, but the idea is to become a kind of an online portal for all kinds of documents related to this field. So there's already a list of books and then links, you know, to Amazon, and there's multimedia clips and files and reports and documents and anything that we can find, we upload them. And eventually, we're still trying to figure out how to do the journal articles. Should we, if you do a PubMed search on Judaism and Health or Judaism and Medicine or whatever, you get like thousands and thousands of hits. And, you know, we aren't going to put these all on the website, but we're trying to come up with some sort of search engine or something where people can go to our site and identify all of these. But at any rate, this is a joint venture of Baylor University, not BCM, but Baylor University and Hebrew Union College, if you can imagine something so unusual. That's what happens when you have me at Baylor University. So this is a joint project. Another project that we're working on that I'm very excited about, you know, when you develop a field, when a field's emerging, what's the next thing you do? Write a handbook, you know, get all the best people together and edit a handbook. So Michelle and I have a contract for Jewish Lights, which is a major Jewish publisher. Stuart Matlins is the head of Jewish Lights. We have a contract to get about a couple dozen chapters from leading figures who have written in some fashion on this topic, again, from almost all the perspectives that I've had in my talk on bioethics and pastoral care and chaplaincy and Jewish healing and research and, you know, on and on across the board. And we have people across the spectrum who've committed. Dr. Abraham Tversky, the famous scion of a Hasidic dynasty, who's also a brilliant, well-known psychiatrist and expert on addictions, and Fred Rosner. David Teutsch is a former, he was either president or dean or whatever of the Reconstruction College. Rachel Adler, who's a probably preeminent Jewish feminist and also now a rabbinic student, and on and on and on. Dr. Ken Park, and people, again, we have people across the Jewish spectrum. I don't know how likely something like this would be within across the various Christian communities, but to find any type of project that can bring together Reform Jews and conservative and Reconstructionists and Jewish renewal and Orthodox and quote-unquote ultra-Orthodox Jews all under one rubric is exceedingly rare. And we've been able to do this in this larger project, and certainly in this book project. And then the very last thing I want to touch on here among kind of what's coming up. This is my personal Manhattan project. As I started to get involved in this, I thought, you know, what's really, I'm an epidemiologist. You know, I'm not a psychologist, I'm not a sociologist. I'm an epidemiologist. So to me, you know, a global Jewish health survey, and I've since scaled that back to national. I mean, you know, but it seems to me that something that would be kind of a health census of the population, but also a needs assessment on healthcare issues and aging and other topics that could provide a kind of needs assessment and a resource programmatically for the Jewish organizations and Jewish federations and so on for meeting the needs of our communities and population. And so, you know, encompass physical and mental health and so on. And I would try to design the questions, probably get a team of people together, try to make the questions as comparable as some of the Israeli surveys that have been done so that there's an ability to compare. And, you know, that's kind of my plan. That's a few years down the line. But my first thing is to finish all these little one-off studies of all these data sets I'm working on. And maybe not only another year or two, I'll have those done, and then I can really think about doing this. And that's when I'm going to have to delve into the Jewish philanthropic world and wherever else and try to, you know, even I'm an epidemiologist, believe me, I have never done a national survey of anything. I have used data that other people have collected as parts of their national surveys, but to mount something will be millions and millions of dollars. And this is not a pitch. I'm just saying this is probably what's coming up at some point. I think if I can do this, then I can say, okay, I can go now. But this is, I would hope in the next 5 years that a lot of us in the Judaism and health community will be part of an effort to do a national or perhaps even a global survey. And so finally, excuse me, what are the take-home points of all of this? Well, yeah. Take-home points. So I think there are three. First of all, that this is an emerging field. I think my subtitle, emerging field comes of age or something. We're coming of age. I'm being optimistic. We're coming of age. The intersection of the Jewish religion and Judaism and the Jewish people and all of that, on the one hand, with health, healing, medicine, healthcare, health-related everything. That kind of interface is coalescing into a field, into a group of professionals and rabbis and academics and doctors and so on. And not only is the field emerging, but there's diversity. I mean, so often diversity becomes a kind of meaningless buzzword. I think in this work, there's legitimate diversity. We are embracing that, and it's something that as Jews we kind of gravitate to. There's diversity, again, across the various professions of people involved in this work. There's also this trans-denominational sense. And trans-denominational is a word we use in Judaism akin to how the word ecumenism or ecumenical is used in the Christian world. Even though, like I said before, we don't call our denominations denominations, but that's a word we use. So we have everyone from the right and left, theologically and halachically, joining together on this work. And then finally, there's a very significant emphasis on research. I was going to say scholarship, in a broader sense than just research. And the kind of research that's going on at this point, there's clinical research, there's people like me doing epidemiologic research, there's social science, there's psychological research, there's program evaluations, there's bioethical public policy work going on. So a lot of exciting things. In the most recent issue of Journal Religion and Health, Michelle and I had a paper. You can find this online. It actually came out online a couple years ago, but it's out in the journal. But it's a kind of, this is almost a sort of an earlier version of this thought, kind of a summary of these various little comings togethers and points of convergence of Judaism and health and medicine. And so if somebody wants to, like an earlier written version of all of this, along with all the references and footnotes and everything else, this would be a good place. This is Journal Religion and Health. Articles called Judaism and Health. Well, so my last slide, somebody that probably means a lot to us here. This quote, the test of our faith is not just what we say, but also what we do. Deeds must match creeds. When I read this in this book, I thought, well, this is actually kind of a pretty Jewish sentiment as well, keeping with what Rabbi Elliot Dorff, for example, called Judaism's emphasis on praxis over theory, or emphasis on doing and not solely on knowing. And I think what's beautiful about this, it reminds us there's work to do. This isn't just some sort of intellectual, nice, we'll write a bunch of papers, we'll collect data, we'll have conferences. This is important work that matters for people's lives. This reminds us that this work, there's something for all of us to do. Jews and Christians and Muslims and Buddhists and Hindus, there's something for each one of us to do if we're to make use of and marshal the human spirit for matters related to healing and to wholeness and to well-being. Thank you.